Okay, well, hello everyone. Thank you so much for joining our 17th Gateway College Lecture Series. We greatly appreciate your support as attendees and the interest in contributing to the knowledge economy. My name is Jay McFarlane, and I am on the board of directors at Gateway and also the research chair in rural nutrition and exercise. Gateway is headquartered, the world headquarters in Goderich, Ontario, and it is the only independent rural research institute in Canada. It's governed by a community-based volunteers who aim to advance rural health teaching and research across Huron, Perth, Grey, and Bruce counties. Our mission is to improve the health and quality of life of rural residents through research, education, and communication. Beginning in February of 2021, Gateway launched the first virtual lecture series, with social isolation being at top of everyone's mind as COVID-19 restrictions continue to heighten. At that time, there is no better time to launch this initiative. So through these lecture series, our hope is to cultivate a culture of rural health knowledge and innovation while virtually connecting communities to reduce social isolation. Leading discussion today is Leith Deacon, Associate Professor at University of Guelph and the School of Environmental Design and Rural Development, and also Gateway's Research Chair of Rural Resiliency. As panelists, we have Lauren Van Ewyk, co-founder of the National Farmers Mental Health Alliance, and also operates Wellspring Counselling Services. Grace Bonnett, who is joining us as one of the project leads on the Great Local Food Project, and also a research advisor with Gateway. Casandra Bryant, a PhD student, and also one of Gateway's research chairs, the chair of Rural Health Human Resources. And David Mackechnie, the downtown Goderich BIA manager. So all have unique perspectives, and I'll hand it over to Leith to lead the discussion.
Thanks very much, Jay. You guys can see the whole screen, maybe, if you can give me a heads up. Yeah. Okay. I can't see my screen for some reason, so I don't know what's going on, but hopefully as long as you guys can see it, then it's great. Okay, so today we do have a lot to get through, and there's just a tremendous amount of information. So we're going to jump right in here. Today's lecture series is divided into two sections, and roughly the first half, the 25-minute mark or so, I'm going to give an overview of the results from the Be Well, Work Well project that has been running roughly for the last year. The results are both quantitative and qualitative, so all I mean is surveys and interviews. And this will be followed by what I hope to be, and I'm sure will be, the most interesting part of today's discussion, a panel discussion with our 4 participants, each of whom will offer their insights based on their expertise. I would also like to mention that the quantitative portion of this project, so the surveys, is complete and fully analyzed. And so that's lovely. What I really am trying to highlight, though, is that the qualitative interview portion, which is much more labor intensive to analyze, is not yet complete. So these are more snapshots of overviews, but don't take this as the final version at all. I start many of my presentations with a slide similar to this, and it is what I call a housekeeping slide. And what I mean by housekeeping is definitional or terminology based, and it is around the use of the word rural or rurality. Rural or rurality are terms that are far from universally agreed upon, and in fact, many researchers argue that it is a highly contested term. For example, I'm born and raised in a small town in Northern Ontario, a general store type small town. Rural. Nobody's going to argue that that is a rural place. But now I live in Fergus, and let's be honest, Fergus has a Starbucks. But that's the thing. Fergus is, by every definition, rural as well. And that is the thing to keep in mind. Rural is simply not in contrast to urban, but rather rural is a complex set of characteristics that relate to and within a place. And rural is changing. It's dynamic. And these changes are often much more significantly felt than they would be in an urban place. And COVID, well, that's exacerbated all of these changes. Urban to rural migration, we've had changing economies, we've had diversifying cultures. Rural is simply more than this middle-aged white farmer stereotype that we have. Rural is is a construction. And in order to be able to design and importantly, implement policies or programs that are meaningful and representative of the needs of the residents from those rural places, it is critical that this construction is understood based on data that has been collected from those local places, stories that have been told by the residents that live there. And that is what this project is all about, gathering local data and really having an opportunity to mobilize that data in events like today to get it back into the community members that have an opportunity to really impact and influence policy and program response. And that kind of gets us to the goal of today. The goal of this project is super straightforward. It's on the screen there. And it's to strengthen the Huron-Perth rural communities by ensuring that all voices across the region are heard and reflected in the solutions. Personally, I'm not a big fan of the word solutions. I just prefer responses, programming, planning, policy development. What are we going to do to ensure that these communities remain and continue to become more and more resilient moving forward? And that is what we're trying to achieve. We developed or designed two objectives in mind. And the first is to better understand the experiences of the pandemic on local employers and employees. So there's a couple things there that are super specific. It's all about experiences, but there are two target groups, employers and employees. And what I mean by that is roughly the participation for the 65 up crew, almost non-existent because they've retired out of the system. Not very much participation in 18 under for a couple of reasons, but big one, ethics. And the second one, most under 18 aren't really full-time in that workforce yet. So this is the cohort that we're really focusing on. And a huge amount of that data was collected from a quantitative survey. And then the second objective is to help plan for future disruptive events. What are we going to do about it? Let's not let the last 2.5 years be for nothing. We have learned a tremendous amount. So let's see what we can do to make sure our communities are more resilient for whatever future disruption there might be. Let's get into some of the basic data, and this is arguably the part that people seem to get the most excited about often. This is the demographics. I love demographics. I can see Casandra smiling. She knows that I teach methods, and I'm really a big fan of StatsCan. And I'm happy to say that while StatsCan is this amazing source of data, it's not the best when it comes to hyper granular small town data. And what we have collected really is representative of StatsCan data. And what I mean by when I say that is it's good. It's credible data, so we're able to talk about it and assume that it is representative of this massive sample StatsCan. Okay, so what you're looking at here are we're going to start with things like the percentage of participation by gender. Overwhelmingly, nearly 80% were self-identifying females. First of all, I mean, believe me, I wish it was 50-50. Of course I do, but the reality is females overwhelmingly outnumber males when it comes to engaging in a research project. And the subject was loosely around mental health and health. And again, that even pulls much more females traditionally. So while we wish the number was more equal, it's not at all surprising. The second thing I want to mention is the age breakdown. And this is actually an area that I'm really kind of excited about. About 24% of the participants were in that 50 to 59 age category. And why I'm excited about that is because it's almost evenly distributed amongst all of the cohorts. We had cohort participation from everybody. It wasn't just that older, closer to retirement age. We had a good number in the 18 to 29 group. If you're in the 50 to 59 group, if you're wondering, that means you were 1960 to 72 born. Okay, so that's the group that we're talking about. But what I'm trying to highlight is that our collected data reflects the current demographics in the workforce. We're not skewed one way or the other. And again, that just really speaks to the credibility of the data. We also asked about household composition. We wanted to know what the responsibilities were at home, if you had children or dependents. And you can see on the data there, approximately 37, in terms of the dependents, most did not have dependents at home, overwhelmingly, in fact, nearly 60%. But the number of people at home was still above 1 to the 2. So these tended to be, we assume, people whose kids maybe have aged out of the household, or they were just 2 adults with no kids at home. But that was not, we just wanted to know composition numbers generally. Ethnic breakdown is also important for a couple of reasons. There is a very strong belief that rural and small communities are overwhelmingly made up of white residents. That is the reality. It is overwhelmingly white. but it is not 100%, not even close. Average would be about between 70 and 75% white self-identifying. And that is, our number is a little bit higher, that getting towards that 80% number, but it's still interesting to see that it is not just this monolith. And that's part of the story I want to tell today. Rural is not just this monolith of everybody's the same. And it's really critical that we identify that. So I am only going to speak largely to this cohort. We can't pull any of the data by the other ethnicities that could have been identified because we don't have a statistically representative sample size. So if people are really looking for those non-white answers, we can pull it in generalizable terms later, but I'm not doing that today. Now let's get into some of the specifics, and I think this is going to be the part that people start to get pretty interested in. What you're looking at right now is sectoral employment by the total sample, by Huron, and then by Perth. The first thing that should jump out at you is down here. The 29, oh yeah, I guess you can't see the slide, but 29.1% of our participation was healthcare and social services, which is much higher than it should be. The numbers for the both areas are 10.4 and 10.3 respectively. But again, this was a health-based study and it was in that wheelhouse. So it only makes sense that we pull, and I can see Lauren nodding. It is vested interest, drinking the Kool-Aid, speaking their language, whatever you want to say about it, but it automatically pulls that group in. And so while we're disappointed, it does kind of make sense. The second highest group was sorry, I just lost the number there, was the other big group was educational services. These are huge cohorts. So again, it does make sense. I want to draw attention to something that isn't fantastic, and it's the fourth one down, manufacturing. Manufacturing sector employment for both counties are 10.9 and 18.8. We only received a 1.3% participation from this group. It was so much, and I can see Grace on there, that she actively and quite aggressively went out with Bonnie to try to recruit. We couldn't make inroads here. So I do want to just come fully clean, and that is a limitation to this data. We honestly don't know why that is, but we tried super hard to get in there. We tried with union reps. We tried with Chamber of Commerce. We did everything we could. We just couldn't get that engagement. And so just to get out in front of that, I do acknowledge that limitation. Now, also we wanted to, as I mentioned, we were all about employees and employers, because to our knowledge, there isn't a study that asks that breakdown. What is the experience of a group of folks that work for someone, and what are the group of experiences for people that employ or in that upper management? And so we did separate that, and you can see those numbers here. Employers, the majority of respondents were employees, which is good. You don't want it to be the other way. The reality is there are more employees out there. So we had 63% as employees, and employers accounted for about 37%. Okay, so good numbers, and we wanted those numbers more or less. Now let's just take a little bit about type of employment by employers. You can see that you can see definite numbers in terms right here for the employer number of people, number of years employed, and then employer number of full-time employees, just to give you a sample. Again, nothing super surprising here. The largest group was in that smaller business type, and that makes the most sense, especially in a rural community. And in terms of the number of employment years, 13 would be like in that upper age or upper length was the largest cohort. And again, if you look at the participation in terms of the breakdown of their age category, that makes the most sense as well. Okay, so just to kind of give a little bit of description there. But now let's get into some of the data that we found. We really wanted to understand for the employers, what was the impact on business? And while 90% said their businesses was impacted, it's important to note that only 34% of that 34% actually said they've seen an increase in demand. So I think for the people on the call right now, perhaps especially David, in the conversations that you've been having, this shouldn't be particularly surprising. And we all know in our personal lives that some businesses have really seen an increase in demand, and we did see that within some of our own data. It is noteworthy that just over 50% of employers indicated that their businesses received some type of government support, and of that 45% that said the support was sufficient. So, I mean, there wasn't a great playbook for the pandemic, and I think that's what we're truly trying to develop here. For the next disruption, what is really needed to be done to ensure that our businesses can seamlessly or as seamlessly as possible continue to function. Additionally, the bottom right side, the ways in which support helps is also interesting to note. And while you're looking at all this information, and I do apologize, there's a lot on this slide, I want to add some contextual data, and that comes out of the interviews. The quote in the text box highlights that advising businesses to increase their online presence doesn't always or did not always reflect an actual increase. And simply coming out, and a lot of that advice doesn't come necessarily out of a rural place, it comes from perhaps out of Toronto. It doesn't make the most sense for a rural context. And that's part of the story we want to tell. And one quote from our participant highlighted that it was important that support to design and maximize online presence is critical. You can't just tell people to do it if they don't know how. They need some help here, and it is critical that we acknowledge that. We asked employees and employers their thoughts on how the pandemic may be affecting fellow coworkers and staff. And I mean, I don't know about everybody on the call, but I've been having these conversations, so these aren't super surprising, but what this data allows us to do is add a little bit of credibility to those conversations that we're having casually. Close to 80% of employees in our participant pool noticed a change in fellow staff and colleagues. The big ones, decreased morale, around 70%. And that's kind of the take home here. And that's getting into that mental health challenge and some of those indicators that there's a lot going on in people's lives. We also asked employers what they noticed, and 70% of employers, not employees, sorry for the emphasis there, but the employers noticed a change in their staff or the group that worked for them. And those changes, the biggest one there also is around decreased morale, nearly 60%. And then of course, notable stress or anxiety, 83. The thing about that, we don't know what's causing that change. And I think all of us, I assume on this call, work in some sort of an environment where you have colleagues and you notice these changes, but is it because at home, maybe their spouse or their kids are learning from home? Is it somebody's lost a job? But what we're trying to highlight here is there was a lot of things going on that really started to kind of layer on and pile on and impacted people's mental health. Getting into some of those concerns, we asked employees what their top employment concerns were. And while the quantitative results highlighted that most were concerned about COVID exposure, and I've ran a very large survey, that is a top concern, change in their job description and increased expectations were 2 and 3. So yes, they were concerned, of course, about their personal health related to exposure to COVID, but they also felt that because of largely around absenteeism, the description of what they were expected to do had changed drastically, and they saw that as an increased expectations put on them by their employer. This was not necessarily reflected in the interview portion, however, and that often happens. People, when they see a quantitative survey, there's only so many options, so they check what they think is the most appropriate. And then when they sit down, in this case with Casandra, to do some interviews, that's not always necessarily reflected. They were more concerned in those interviews about economics, quite honestly, and a lot of discussion around a living wage. And I'm not entirely certain why that is. There are a lot of conversations about inflation, a lot of conversations about cost. So maybe because of when in succession in terms of those interviews taking place, maybe that's why, but there is a bit of a difference between that quantitative and qualitative data in this instance. Excuse me. We surveyed participants about the impacts of the pandemic on their well-being and what parts they thought within their personal well-being was the most impacted. Nearly 80%, so 78% said their mental health had been the most significant area that had been negatively impacted. That's 80%. That's 8 out of 10 people. That's a really, really large sample. This was followed by employment satisfaction and physical health. When we tease this out in some of those qualitative interviews, examples were given could be indicators of negative mental health, and you can see them there. And what I've tried to do is draw your eyes to the most important or kind of the most poignant parts of those quotes in the red. So they're not as calm as they used to be. I definitely drank way too much out of worry and so forth. So taken together, painting this picture, it really starts to talk and illustrate what was going on in people's head, not necessarily just at work either, at home. And so often for the last two years, home and work were pretty much on the same page. So many people were working from home that it was, even though we were told to separate out, it's super hard to do that, especially when you've got kids coming in and crawling around on you. It does get very difficult. We asked what types of support, both formal and informal respondents relied on. The most relied upon types of support include healthcare or health-related services at 81.8, so 82%. Family and friends are the next two. And I'm really hoping that our panelists will talk about this today. But the issue with that is that when you're relying on your friends and your family, you're adding to them. You're adding to their or perception of responsibility. I don't want to say it's a burden, but on their burden. And it's impacting their own mental health. And quite honestly, I could have one of my best friends come up to me and say things are happening. I'm not equipped to provide that kind of support, quite honestly. And I don't think most of us are. So it is really important that we start to recognize this, so that people do go through the correct channels and avenues to access support. We asked participants about the short-term impacts as well. Ideas around labor shortage were tops across the board. And that hasn't changed, quite honestly. We are perpetually inundated with information that our labor sector, particularly in the healthcare sector, the shortages are very real. And if for anybody that has had the displeasure of visiting a hospital recently, you only have to go to Emerge for a second to understand what we're talking about. Increased costs of doing businesses were also listed by employers and for employees. It was similar that labor shortage was the most common response. So across the board, lack of social connection was cited, as well as a complete change in how day-to-day work occurred. Everything has changed. And as somebody who works at a university, I wasn't outside of that change. It affected all sectors virtually at this point. It was so significant. And this was echoed by a participant who noted that their business had to completely change how business happened. And you can see that I've highlighted there on your slide. Moving away from short, going over to long-term impacts, labor still, and we all know that this hasn't changed. The labor force restrictions and labor force limitations do continue to really bog us down. Increased mechanization, or more accurately, accelerated mechanization. So we always, and we have been for generations talked about how our workforce is becoming more and more mechanized. COVID accelerated that very significantly. So I'm not suggesting COVID is responsible in any way, but if it was just kind of going like this, it really, really drastically increased. Within the more workforce side, increased mental health concerns and a change in day-to-day living, socialization again started to come through the data that was collected in those qualitative conversations. And this was also reflected in the quantitative, most noticeable decrease in face-to-face interaction. So especially for folks that do work in that face-forward type employment, they noticed it quite poignantly. I do want to talk about what's going on in our rural communities. I started the presentation by highlighting the importance of focusing on rural. So I want to just take a quick slide to talk about the changes in those rural areas. Overwhelmingly, the responses were around mental health implications of COVID, except a lot of it had to do with stigmatization, and particularly for males. So conversations around stigmatization, asking for help, or just saying, listen, I'm just having a bit of a tough time here, keeping my head above water, and not being stigmatized or judged for that. There has been a lot of conversation happening around that. Increased reliance again on that friends and family, informal networks, change in community socialization, and then labor shortages in those rural contexts, changes of the temporary farmer work program and so forth, really affected our agricultural producing sector. Now, this slide is, I think it's a really great slide. I love a word cloud because they're kind of like a stem. Everybody kind of understands them. So what you're looking at here, and anybody who's heard me give other presentations, one of my recommendations always is educate the public on what mental health is, because there is a really significant disconnect between what mental health actually is and what the public seems to think it is. And often they are including mental illness and very, very significant and serious illnesses in on the same conversation. And anybody who works in this area knows that they're not the same. But what you're looking at here is a word cloud based on definitions. So we asked in an interview, what do you think mental health is? And this is basically just taken. And the larger the word, the more often it was said. It's a really clear and easy way to represent data. So connected to physical health, and I think that's super cool because mental health is health. And it's really, really critical that we start to have that conversation together. So I was really happy to see that. But then you see things like, that's a big question. And that's problematic. It isn't a big question, actually. People should have an idea and be able to frame this answer in a way relatively succinctly, but we can't do that. And I think it's really critical that we recognize the variety as well in this answer. Very little consistency, a huge range of answers. And it speaks to the need to really recognize and educate not only the public, but everybody on what's going on in rural spaces around mental health. Some of the quotes that you can see here, I think it's vastly underexplored and undertreated. There are more and more conversations around mental health, particularly in small and rural communities. And that's great to see, but let's keep pushing so that these conversations turn into a little bit a tangible outcome. Now let's change the focus here. Let's get into some of those formal supports and what can be done and what are the challenges. Participants indicated that they felt the healthcare system is inaccessible. And if we go back to that previous slide about what mental health is, this is related to that. How do you access the system? And I mean, if you're super lucky and you've never accessed the system, chances are you have no idea how to do it. And if you've had a friend say, I'm looking for a little bit of support, unless you work in this area, the chances are you don't know where to send them. I often give an example when I give a presentation, and for anybody that's remotely around my age, 1-800-668-6868 being a number that a lot of people remember and recognize. And it was super heavily promoted in the 80s and 90s around it is a children's helpline. So if you knew or were experiencing, you knew a number to call. And I never had to call that number, thankfully, but I still know it this many years later. We need basically something like that for mental health, a resource place that people can call and access the system. And that if it currently exists, people don't know about it. So that was the big thing. There was a lack of knowledge about where to start and how to access that support. Again, especially for males, but not just males, stigmatization was listed as a challenge. They really, really do not want this to become public knowledge, and they were afraid of what their peers and their neighbors might think. Overwhelmingly, these concerns, though, if I were to just sum it up, education. A lack of education across the general public, but also within the public. Not only what is mental health, but how to access its support is super critical. And that is one of the most important findings out of this project. So I'm starting to wrap up the presentation and turn it over to these super qualified, excellent panelists. But I do want to end with some recommendations. I would like to start with those on the phone that represent employers at the workplace. The big one is to increase awareness, not only amongst management, but across the entire chain all the way down. It means formally, but it also means informally. There's a need to increase training and education around mental health, to offer opportunities for employers and leaders to improve their knowledge, but also to access supports for themselves. So this is not just for employees. It is for everybody, and it's not going to be the same. And that's part of the point here. It is not a one size fits all. There's no silver bullet. You need to ensure that the supports and responses that we're developing are reflective and representative of whoever's going to access those services. And that includes employers and it includes employees. But there is this big need to really decrease the level of stigmatization around it, and to increase training and training opportunities for people that work in places. So that's my first set of recommendations for those that are in the position to make those changes in the workplace. Government, I mean, I don't know who's on the call from government. If nobody's on the call from government, I guess that's problem number one. But if there are people that are on the call from government, it is really important that there's a recognition that what works in London, Ontario isn't going to work in Goderich. What works in Toronto isn't going to work in London. There's a need to recognize that rural and small communities are different. They're not better, they're not worse. They just are different, and that's the reality. So the first thing is government needs to recognize that it's not a one size fits all. And the big one is government must be able to respond in a timely and efficient and effective way. COVID, absolutely, we didn't have that before. We never had that type of shock. But the thing is, and I hope everybody knows this, there will be another COVID. It won't be COVID, but it'll be something else. We will have another disruption, and let's not let COVID be a waste. Let's take what we've learned here and enable the government to be able to respond quickly and effectively. And communication is the key part here. It has to be a clean, consistent, and clear message. There needs to be a place to get this data. Everybody talks about misinformation and disinformation. If we can try to minimize that by having one site, one government service that can provide that information, that highlights things like tax implications. There was a lot of disconnect around tax implications, what that means in terms of small businesses, what are the flexibilities around grants. All of that has to be discussed, but the big one is that communication between the government and the public as well. The other one is areas around provision of services. So our healthcare system, a lot of people say it's broken. I don't think it's broken. It needs a little help though. And if you live in a small rural community, the chances are you don't have an OHIP covered mental health service available to you. Chances are it's a private healthcare facility. That's not covered by OHIP, and that is the problem. So there needs to be a little bit of flexibility, maybe not all the time, but especially in such a disruptive state. We need to be able to have a little bit of flex built into our system. The government must recruit the small and rural areas. Of course, we know that anyone who has had the pleasure of waiting in a waiting room recently, that's not just a rural area problem at all. That is across the board. And the last one is education. There is a significant disconnect between the government and the community members, what's going on. And we really feel, and our participants noted, there is a significant need to bridge that gap. So you can't just say we are the task force we are not the COVID response task force, and here we have Casandra, she's our representative of rural Ontario. That is not going to fly. We need to ensure that there is adequate and true representation, and to really increase and improve the communication between all of the sectors. That's my quick and really fast and dirty overview of this data. And I really need to highlight and thank both Grace and Casandra, who are on the call, who were so poignant and so important for collecting this data. In total, there were 580 surveys completed, and there were 21 semi-structured interviews and 4 focus groups. And I know that a lot of people are like, oh, 580 versus 21 and 4. Believe me, the 21 and 4 data collection and analysis is so labor intensive because we're long-winded, and it's so hard to understand what people are getting at and to tease those themes out. So again, thank you both for all of your help with this. What I'd like to do now then is stop the presentation and kind of open it up to the panelists. And what I'd really like is for a super honest and open and friendly conversation. If there is a question that I ask that you don't feel comfortable, there's no pressure here. Just tell me no, and we'll go on to the next one. But I do think your opinion and your expertise can really bring a lot to this conversation. So what I'd like to do is start with Casandra, if that's all right with you. I would like, and each person, because of the time restrictions, you have about 3 or 4 minutes for each answer. And I know that's terrible, but that is just the reality of things. So given each, and this is the same question for each of you. So given your expertise and your familiarity with the region that we've been talking about, with the rural context, are you surprised by the data that was collected? And if it's yes, can you tell me why that is? And if it's no, can you tell me why that is? Casandra?
Thanks, Leith. That was great. And I can speak to it more from, I guess, being involved in the quantitative aspect, phase 1, and then phase 2, for me to see what changes I saw, but also what was confirmed with the qualitative from the quantitative surveys. And it was really interesting. And I would say, yes, surprised and no surprise, like both at the same time. Just highlighting information, like just getting a little bit more information on why those that did not access the government support, some of those reasons for there, and knowing that the criteria to be eligible shifted, and there would be businesses that would be eligible at one point but then not at the other. So there was a lot of confusion around that, as well as just even the tax implications. I think that was a big thing that came out of the qualitative, to understand why people were a little bit afraid. But even those that did receive that support, there was it's understanding it for themselves as a business owner, but also the education for their accountants or anyone else who supports them in their business, So there was a lot of heartache around that when taxes came around, to understand the implications of that piece there. One of the things that I did find was interesting is knowing that job security concerns for employees was 26.4 when we did the quantitative back in November to February 2022. Yet we know that there are many help wanted signs. We know that there's a huge labor shortage, and it's really, really difficult to retain employees, especially for those that are in the front line, where you have people that are hopping from job to job to job. So that was another thing. And the last thing I'll maybe highlight is just the results really shared in the phase 2 really shared the extent of possible trauma and mental health challenges that we will be seeing with employees and employers both. There was a poignant story just for a quick service restaurant who did employ youth and actually older. So it's interesting that you talked about that. So, we're looking at a quick service that kind of had the older generation and the younger generation. But the fact that many of these youth were put into situations where they were dealing with very irate, rude, and customers, and having to manage that and coming out of that and trying to figure that out. So there's definitely that increase, if you will, and the interviewee even said probably PTSD, will be coming from that when we take a look at that. There's the distrust and confidentiality if you want to seek support to find it in your local areas. So a lot of people go out of town if they want that. And many did find that the results from the alcohol and narcotic consumption from the first survey was low. When we look at that, especially when we look at the social aspect. And one individual had shared that she actually stopped drinking. She increased her drinking when the pandemic started, but then she actually had some health issues that she had to stop drinking. And that had a huge impact in her interpersonal relationships. And people were uncomfortable around her if she did not have a drink. She could have a drink that was just club soda, but if there wasn't alcohol in that drink, that people were really bothering her and people were uncomfortable, and then she was getting uncomfortable. So that even then leads into the social awkwardness and divisiveness that was happening in rural communities. I'm going to leave it there and pass it on. There's other things I can talk, but those were kind of things that popped out for me when you were talking, Leith. Oh, you're on mute, Leith.
I can't believe that. There's something. Grace, same question. Are you surprised?
Yeah, so I can speak to this from living in Huron County for 22 years of my life, as well as the experience I've gained through working with the Be Well, Work Well project. I would say, considering what we know about rural regions and the various issues that are compounded by living in rural regions and the barriers, I'm not surprised by the data. However, there were some aspects of it that I found exceptionally interesting. That social connection piece, I mean, that's such an important aspect of rural communities, and it was extremely impacted by the pandemic. And as Casandra touched on, that divisiveness, we've seen that social circles have shrunk, and the lack of human contact has been significantly impacted in a negative way as a result of the pandemic. Casandra stated a statement that came from one of the interviews regarding kind of that connection that you have to others in rural areas. It's not true that you don't know everybody, but you know almost everybody. So that really highlights that social capital and community piece that is so ingrained and inherent in rural communities and has been extremely impacted by the pandemic. I think the informal support piece too that Leith touched on is very interesting. And I think that's further amplified in rural areas, relying on informal support services, but this can be very dangerous if these informal supports are not equipped to handle these mental health crises that they may be relied on for. So that's a big piece that I think we need to look at and dive deeper into, as well as the stigma piece specifically in rural areas when it comes to accessing services. And as Casandra mentioned as well, the distrust and confidentiality. So I think this is partly due to the demographics in rural regions, but I also think this requires a bit of a mindset shift because, as we know, COVID's here to stay. It's not going away. So we need to ensure that these services are accessible. And the labor shortage, I think, was increasingly a concern in rural regions. We saw from the data that it was extremely visible in Huron and Perth counties. So that's something you have to consider as well. And the shifts between sectors that have been ongoing throughout the pandemic. Issues have been difficult to navigate in rural areas. And it's a mindset shift that we have to understand these issues aren't going away. So I'll leave that there and I'll touch a bit more on the healthcare issues maybe for the next question. So.
Okay, thanks so much, Chris. David.
I will say I wasn't honestly surprised at all. The results that you guys have collected very much reflect what I hear talking to business owners and employees, not just in our downtown, but in general in the community as a whole. The employee shortage has been a huge issue. We've seen a lot of people, particularly in the service industry, shift to other jobs during the pandemic. So that's created a huge shortfall, particularly in restaurants, because they had a lot of the most consistent insecurities during the pandemic. So they were more frequently shut down. They were more often laying staff off. When they were open often just for takeout. So you didn't need as many service staff. You didn't need as much kitchen staff. So it's really diminished the number of employees working in that industry. I think, Casandra mentioned PTSD. A lot of the industries faced very serious blowback from pandemic restrictions. I often heard it said by restaurant and store owners, I don't understand why we're reinforcing government regulations. If you look at police officers and health inspectors and people that often do enforce those regulations, they're getting paid much better than minimum wage students standing at the front of a restaurant asking somebody for a vaccine passport. I've spoken to several business owners that received death threats over the course of the pandemic. I've spoken to employees, and I'm talking 15-year-old students who have received death threats over this. And I think one of the long-term results that have come of this is that a lot of people have taken this negativity and they're still doling it out to employees in the service industry. So restaurants now, and you've talked about shifting and changing roles, they're very short staffed. And so a lot of those people are doing, 2 or 3 different jobs. Your waitresses are also doing dishwashing and, your kitchen's running food and helping with the bar. And so there's that obvious pressure in the workplace that's created by this short staff. But you have people that then come in and will yell at somebody because the food took a couple minutes longer or something like that. So the long-term effect and the mentality that you can treat people working in service poorly seems to have carried over and spilled over. So I think, again, you start talking about the need for mental health supports, and that's just going to keep increasing as time goes on. Again, particularly for people working in the service industry who are still seeing the pushback because of the staffing issues and because of those shifting roles and stuff like that. In terms of businesses, there were certainly businesses that did better during the pandemic. There were certainly a lot of businesses that lost a lot of sales. And I could see some staying around the same amounts. I do think that in terms of the supports and stuff like that, it was very, very difficult to access those services. In a lot of ways, those financial supports, there wasn't a lot of clarity as to who could or couldn't apply. And I would say that of the businesses I've spoken to, there have been a number of businesses who certainly needed financial support, but just slipped through the cracks of what was and wasn't allowed based on the grants.
Mm-hmm. Okay, thanks so much. Thanks so much for that. And Lauren?
Well, I'm so thrilled to be part of this team today. And unfortunately, I'm not surprised by the statistics, except for the one that Casandra mentioned with the alcohol use. I would have expected it to be significantly higher. We did see some other research that pointed it closer to 50% of an increase. And we know in our rural populations, we tend to be a little bit more almost accepting of alcohol use as a really an unhealthy coping strategy, but one that we almost endorse or accept. And so I would have expected to see that number higher. But a couple of the things that really stuck out to me, and you saw me nodding my head at the beginning, because I was just speaking with a radiologist technician this morning, and she was talking about the burnout that's felt in the healthcare system. And so it's certainly very personal. The experience is so personal to that representation. The other thing to be aware of, what we know is that women will typically not seek out services for themselves unless their partner does as well or does first. And so we become the sole support to our spouse who maybe is experiencing, or a partner who is experiencing mental health distress. But the telling sign of that is in your numbers, in how men are more likely to not seek services and are more likely to be due to stigma so it's kind of like a double fold impact almost, right? Like not only are they're the sole support for those that don't want to talk about it and then also for themselves. So that was really an important key point that I thought was brought out. The other thing you talked about is that job description change. I was doing some work with a few of the other colleges around Southwestern Ontario. And when students, of course, were coming back to school, there was a lot of shifting that went on within our educational institutions. And what those employees shared was how difficult it was to suddenly be taking on a new role, because we were lacking confidence kind of coming back into the workplace in and of itself. And I think you see that in the service industry as well, right? Where some of our confidence was a little bit shaken as we kind of reintegrated back into I don't want to say post-COVID, because I don't believe we're there yet, but in some more of the normalization that's gone on lately. But unfortunately, that confidence being shaken increases our anxiety. It increases our we've talked a little bit about post-traumatic stress disorder. And I'm careful with that term, because it's not so much the trauma that happens, it's how we process the trauma. And we are lacking some skills in processing our events now, simply because, like, for instance, there's over 25,000 children that are on the wait list in Ontario for mental health services. So we've got this issue from the ground up, and it trickles both up and trickles both down. And so, I wasn't surprised, but I'm glad it was so encompassing of all the different pieces of the research that you did.
Thanks, and thanks everybody for all their comments on. Before we get to the second question, I do want to highlight the point of that question. Of course, the point of the question is that we're all having these conversations, and you all mentioned it in one way or another. The reality, though, is when you are organization X and you're having these conversations, and you need some support and some extra, maybe some financial support from the government, you're not going to get that from those conversations. So the double-edged sword here is we're collecting data that we kind of know the answer to, but without credible data collection, it really, really makes it hard to get anything. So I am disappointed that you're not surprised, I suppose, but of course you're not surprised. You're all engaged people in your relative and respective communities. So of course you're not, and you all have friends, families, and neighbors that have probably had conversations with you. So it's disappointing, but it is important to collect this data. So where I'm going to end with is a second question, and it is about what now. So data collection is great. I've made a livelihood out of this, but really the reality is, what are we going to do now? So the question is, how do you move past data collection? What should be the next steps for tangible, impactful outcomes from this project? But this is not the only project in town. Other projects that have been collecting data that is super, super important. What should we do with it? And I would like to just go in the reverse order. So I'll start with Lauren, and I'll give you a couple minutes, and then we'll move through.
Okay, I think the first word that jumps out to me is this intersectoral collaboration, and I see it at work here today, right? Where there's different representation, but that is a really key concept. Is if we can overlap some of these services and come from representation from all the manufacturing and agriculture and the healthcare and the education system to ensure that the programs that are developed are fitting. And I appreciate, Leith, what you talked about, because during the pandemic, there was a lot of push towards the online sales. Well, one of the things we saw in the agriculture industry is lots of people started going to farmers markets, and the farmers were like, wow, this is fantastic. Well, this year there's fewer people attending farmers market. And so with our high input costs and less revenue, it's not to mention the drought that we've seen in many areas of Southwestern Ontario, certainly in here in Perth. So how do we move past that? It's got to be done intersectorially, I really believe. And I think your research highlighted so many critical aspects where you mentioned having a therapist in the school system. Wow, wouldn't that be amazing if we really prioritized mental health for kids? Wouldn't that be incredible if we provided them with the services they need to thrive at a younger age? Who would have thought, right? Amazing. I really think it would be some incredible things. The other piece, we talked about the low manufacturing response. How do we change that? I'm sure you've heard of Buddy Up, the Buddy Up campaign. You talked about it through mentorship in your research. And I'm a big believer in that. I'm a big believer in how do we help start those conversations and let people know that there's a safe place here. And so helping employers set up those programs is really a critical aspect to changing the trajectory of mental health in the workplace.
Thank you so much. David?
I think, Laura hit the nail on the head with the increase in mental health services. I think that is without question something that, before we see another pandemic or even just dealing with the results of this pandemic, it's certainly something that we need to develop a much better system in this country. I mean, we have doctors for almost everybody, but not psychiatrists or a therapist or and those access to those facilities or those services definitely needs to increase. I think from a business perspective, if we're going into another pandemic, if this happens again, if we see lockdowns, the government needs to work to make better grant programs so it's not a one shoe fits all. Because again, I think there were a lot of businesses that needed support, and I mean, we've been very, very lucky in our community. The community support. And maybe this is unique to a rural area, but was phenomenal for our small businesses. And by the grace of that, we have not seen the closures. I wander around other communities and the number of businesses that are shuttered up, and again, particularly restaurants, but stores, and disproportionate to what you would normally see opening and closing in an area. So I think there's a lot of potential growth there. I also think as we look at regulations, we need to find a way to not have to put the onus on businesses to enforce regulation. Again, when you see a 15-year-old kid getting a death threat because they're asking for a vaccine passport, that's not fair. And unless the Ontario government wants to pay them what they would be paying, an OPP constable or something like that, then, we certainly have to make sure that we're asking people to do work that's appropriate to what their pay is, and enforcing those sorts of regulations, unfortunately, was not. And that's not to say I don't believe in the regulations. I certainly do. But again, not hoisting that responsibility on a minimum wage employee who's already dealing with, stress and pressure of being understaffed and, the potential of being exposed to COVID and all the other concerns, hours, financial insecurity, and everything that came with this pandemic. So.
Oh, thank you so much. Grace?
Yeah, definitely. I think this question is very important. I think this is what we really want to get out of this study. It's so easy for data just to be placed on a shelf. And I think I'm speaking for Leith, Casandra, and Bonnie as well when I say that's not something we want to happen with the Be Well, Work Well project. As Leith suggested, the data is definitely essential and we need it. but we want to ensure that the data and recommendations identified in the study are translated into impactful actions and solutions on the ground in the community. With that being said, I think in order for this to happen, we need to work with the community. We need a comprehensive community response in which mental health supports are widely available, whether it's at home, in the workplace, throughout the community. And part of that is increasing the availability and access to those supports. We have to recognize that the individual can't be solely responsible for seeking mental health supports. We need to take a holistic approach to it, while also considering the uniqueness of rural regions and taking that into consideration as well, with the increased barriers and issues that exist here. So yeah, just ensuring that we're working with community to ensure that our response is reflective and representative of what has been identified by the community, ensuring that our actions are culturally relevant. And as Lauren suggested too, I think part of this is that intersectoral collaboration, working with other service providers and community members and groups to ensure that the programs and services are representative. Furthermore, I think we need leadership and accessibility around mental health training. And I think Gateway, this is supported by their mission by increasing knowledge, education, and communication around mental health support so that they're widespread throughout the community.
Thanks, Chris. And for the last word, Casandra.
I'll be very quick because I know Jay is back on here. Just one thing for businesses and workplaces, not just focusing on recruitment, but retention. That's, I think, a huge piece. And then the other piece that I'll touch upon is we need to start having conversations on how to rebuild social capital within our rural communities, because that really has taken a huge hit and that impacts everybody in every part of their lives. So I'll leave it at that.
Thanks. And so before I turn it over to Jay, I want to thank everybody for participating. And I also want to note that this is a small project. I want to note that this is the data that we've gathered, and there are a lot of other small projects out there, but all kind of advocating around the same idea that from an electoral standpoint, rural small town often doesn't and can't have their voice heard. And I understand the math around that. I completely get it. But the reality is that everybody on this call today had something to eat, and that food in all likelihood came from a rural space. Most resource extraction comes from rural spaces. The economic impact of rural and small communities towards Ontario, but also the national GDP is very, very significant. And by neglecting, or in my opinion, ignoring the rural and small community voice, you're impacting our ability to participate in a meaningful way. It's really, really important that the government understands that it's different here, and we need response plans and supports that are related and reflective of the realities of the people who live there. And it's really important that all of these projects kind of work together to have that voice pushed. So again, I want to thank everybody for participating. I know everyone's super busy, and but this was a great conversation. And if anybody does have any additional questions, I know there was just two in the chat. The one around cannabis use has already been answered. And the other one was about government, about do I have a list of government contacts that should be contacted by individuals? Honestly, I'm a fan of calling your MP. That's what they're there for, your counselor. That's what their job is. It is really important. We do have municipal elections coming up. Vote. Don't vote for your kid's grade 3 teacher either. Vote because they're good at the job. Vote because they're going to advocate whatever it is that you think they should be advocating for. We need to understand that that council, that hyper-local vote really, really matters. That really impacts the decisions on a local scale. And then if that's not working, call your MP. That's why they're there. And that's what I would recommend. But no, I don't just have a master list. I wish I did. And if somebody does, I'd love to have it as well. But thanks so much, Jay, if you want to close out.
Yeah, sure. Well, thank you, Leith, and thank you to all the panelists for your insight and wisdom. I think building rural-specific solutions is a great thing to achieve, and using the evidence and best practices like what we've heard here today. I think it's great to have these conversations about what it takes to start this process of building rural-specific solutions. So thank you everyone again. If you're watching this from Hurontel and you'd like to join us for future webinars where you can interact with panelists and post questions in the chat box, you can register at gatewayruralhealth.ca. A huge thank you to our sponsors, DeJager Town Square IDA, the Town of Goderich, Zayers and Goderich, Libro Credit Union, CIBC Private Wealth Management, McEwen and Fagan Insurance Brokers, and of course Hurontel for broadcasting locally. Thank you all for your continued support, because without you, the lecture series would not be possible. Gateway is a not-for-profit charitable organization, and we greatly appreciate and welcome any support we receive. Lastly, thank you again to all the attendees who are joining us today, and we look forward to seeing you at the next lecture series on November 1st at noon. Again, you can register at gatewayruralhealth.ca, and thank you all for joining us today. All right. Bye.
Thank you.